Welcome to Bwindi Community Hospital. Bwindi Community Hospital is 16 years old. It's a clinic that started in 2000 and now has grown from under a tree where we started serving the Batwa, but we are now a hospital with 135 bed capacity. We have inpatient services, outpatient, HIV, surgery, local health insurance, and then a training section where we are able to train nurses and midwives from the local community and empower them to address the need for health, human resource services in the community. I'm going to take you in and welcome you to the hospital so you can have a tour and get to see more about what we do in the hospital and learn more. You'll be more than welcome to come and join us to work with us. This is our outpatient department. We get to see on average 100 consultations every day. Here we get to see all conditions of patients: pneumonia, malaria, diarrheal diseases, infectious diseases. And previously malaria was contributing about 10% of what we would see, rather about 46% of what we see. Currently malaria is less than 10%. Diarrheal diseases have reduced by over 90%. Upper respiratory tract infections have reduced. Currently, the main reason we get to see patients coming in is trauma, which is as a result of road traffic accidents. We have triage, we have outpatient services, consultation rooms, and we are also now building to see how we can have more of chronic patients, rather patients with chronic illnesses such as hypertension, diabetes, mostly which could be lifestyle diseases. To address that, we've also recently added an emergency unit where we can handle patients who need emergency care and who are from trauma road traffic accidents. This is our HIV and AIDS program area. We have several services in this place. We have voluntary counseling and testing services where people are encouraged to know about their HIV status. We have treatment services, we have a pharmacy, we have a consultation room, and also TB services under this. As well, we have the records room where we store all the patient data. Maybe a highlight is that currently we have 1,067 patients who are active in care receiving treatment from here. Currently, the new infection rate has reduced and we stand at 2.1%, and the recovery rate for TB, which is so much common or which correlates very well, rather very common among HIV patients, is 100%. We are also looking at having more of elimination of mother-to-child transmission of HIV, and currently we are at 97% success rate. Now, we are going to the Mothers Waiting Hostel, where pregnant mothers come and wait for their deliveries. Most of these mothers come from very far areas. They have maybe identified risks while they are pregnant, and they come in here before they are in labor to be able to have safe deliveries and have positive outcomes. Most of them also come because they need to have some time to rest, and while they are here we give them health education, prenatal checkups every day. We are also looking at empowering them to have more skill to earn a living when they go back at home by teaching them new vocational things. Well, we are now going to our children and pediatric ward, where we admit children from 0 days to 14 years of age, depending on the different conditions or complications they have come in with. Most of these are very young children coming in to seek care to save their lives. Had it not been because there is this facility, many of them would not make it in life. I will welcome you to come inside and then have a look at the service we provide in this ward. This is Pediatrics ward, or the ward where we admit children from 0 days to 14 years of age, depending on the different complications they come in with. This area is where we have children that come in and need very close monitoring. That's why it is close to the nurses' duty station so that the nurses can help. As well, children here are also closely monitored by the nurses, and we get quite a range of ailments that come in here, such as malnutrition, that is mostly in this cubicle where we are. We have malaria, diarrheal diseases, upper respiratory tract infections, skin infections, as well children who have been operated are admitted here. On average, we admit 120 children in this ward, and we also have a section for the newborn or the neonates, where we admit on average about 30 patients or 30 neonates every month. On this ward, what you will find more unique about this hospital that is not in any other hospitals is that we have a kitchen where we prepare children with malnutrition food. What is also more unique is that we have a garden where we teach the families about how to prevent malnutrition. Malnutrition, in most cases, people want to just treat it in the hospital, but as a hospital we have decided we teach the communities how to grow food, we teach the families how to grow the food, teach them to prepare, then so that the food doesn't lose its nutrient value, and then they are able to taste the food. When this has happened, we've seen malnutrition drop from over 18% of the admissions that we would have on this ward to currently less than 0.5%, like over the last 6 years. This is the Community Health and Battle Program area. We have a team of male nurses, very up to the task, ready every day going out to the communities, riding these motorbikes, mostly to do health education and influence behavior change. It's less costly and has a high impact. And we've seen tremendous reduction in disease burden because of the follow-up of these people, educating them on what would be the best practices to stay safe from any ailments. We follow up all pregnant mothers, children under 5, cases of malaria, malnutrition, diarrheal diseases in the community, all have reduced because of the intervention of these nurses. This is a map of our immediate catchment area where we serve a population of about 70,000 people. In here we have 101 villages and an umbrella of 502 volunteers who are working with the nurses to serve this area. So we have this, and this being our immediate catchment area, and the green being the Bwindi impenetrable national forest. While the nurses are going out in the community, they work with the volunteers. We also do school outreach programs where we go and do health education in the communities. We follow up all children under 5. We also audit the death among there and see how we can prevent any other death that would have happened in the communities. This is a training section for the hospital where we are training health workers, which is actually human resource for health service is a very big component in service delivery. In the country, we are understaffed with the health workers to serve the populations that we have, whereby close to 80% of the population stays in the urban areas, but with very little people, about 20% of health workers serving in the countryside, where we have the majority of the population. 80% of the population stays in the countryside, while 20% of the health workers are there serving that, and 80% of the health workers staying in the urban areas, serving about 20% of the population. So we have registered success where students from this school are going out serving in the communities where they don't have to be worried about the hard conditions because they are trained in the hard conditions. They do community placements in this service, in these centers, and they are able to continue doing this as they are serving the population. At the moment, the school has 402 students who are trained in here with both nurses, midwives, and now we have recently even started another school to train clinical officers or physician assistants. What started under a tree 18 years ago has turned into a hospital, the best hospital in the region, serving a population of over 280,000 population, depending on the service that people want. And it's now recognized among the best hospitals in the country. And now we are serving almost the whole country. People come from as far as the north to seek health care services from this Bwindi Community Hospital. Our plan is to be able to provide more of tertiary care that otherwise would not be in reach for the population within the country and also this community. So we are looking at doing more of super specialized surgeries. We are looking at how we can even improve more of the quality of the care we are providing for these people. But consequently, we plan to see this as a teaching hospital where we would want to have this as a university hospital, teaching more courses like medicine, pharmacy, or public health, dental, and also several students coming in to do master's courses. At the moment, we are so much focused on research, where we are wanting to use this research to influence the best practices for the interventions we are having in this community. We started small, but little by little, we shall be able to see this as a healthy and productive community, free from preventable diseases, with excellent health services accessible to all. Thank you very much.